Okay, we'll call the Health, Human, and Social Services Committee to order, and the first order of business is to approve the minutes from last month's meeting. Mr. Bill, seconded by Peter. All those in favor?
Aye.
Opposed? Carried. All right, Rob, we'll turn it over to you.
Everyone has a copy of the my agenda items. First item is a resolution request to amend the 2018 Warren County budget. This is to allow pass-through of 100% state funding from New York State Office of Mental Health and New York State OASIS in the amount of $87,074. There are a couple of different components to this funding. There was a New York State minimum wage enhancement that some of our agencies were eligible for. There's a 3.25% workforce COLA that some of the direct care staff were eligible for. And then there's a supported housing funding increase included in this as well. There's an attached Schedule A that shows the agencies and a breakdown of the amounts. We would like to be able to pass this funding through to our agencies.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Lowe. Any discussion?
What's the supportive housing?
The supportive housing is run by the Warren Washington Association for Mental Health. Housing for senior citizens and individuals. The supportive housing is a certain level of housing, different levels of housing, have various levels of supervision. This is allows for apartments in the community with support from staff visit individuals living there and provide support to them.
So they made an increase on appropriations for that?
Yes.
Okay. Just to keep up with.
So that would allow us to develop additional sites.
Okay. Thank you.
And those are all right in this area, Rob, the sites for this supported housing?
Yeah, they generally tend to be like in the Glens Falls, Hudson Falls area. The funding is split between Warren and Washington.
Equally?
The supported housing funding, I think, is split equally.
Thank you.
I can verify
From what
that.
I hear, they don't have any money. You know? I just want to make sure that, you know, because I've come across things in the past where we've contributed a little bit more. And
This particular table doesn't break down between the different increases that were coming. And they had a similar schedule for Washington County. Again, it didn't break it down, so I'll have to get that breakout for you.
you know, just to make, you know, since we're sharing it, I just want to make sure it's equally shared. I mean, I've come across things where it hasn't been. It seems like,
And sometimes the funding isn't equally shared, but it's equally available. So residents of Warren County aren't just getting placed in sites that are funded by Warren County funds. In other words, if you're a resident of Warren or Washington County, you can access any of the services of the Association for Mental Health.
could it be based on the person? You know, if it was a Warren County person, so say we have, you know, say there's 100 in there, you know, 100 in the group, and, you know, 60 of them are from Warren County and 40 are from Washington County. Is that how they base? I mean, I would just want to make sure that,
It really varies. Sometimes the funding is based on some type of a formula like that, based on population or utilization. Sometimes the funding, they just split it down and say half for Warren, half for Washington.
okay, thank you.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried. All right,
The second resolution request is for us to award, again, 100% New York State Office of Mental Health funds in the amount of $443,760 development of community serving community treatment team. We call it an ACT team. This is a multidisciplinary treatment team that provides treatment in the community for seriously mentally ill individuals. RFP for this funding in December, when the Office of Mental Health notified us that they had funding available. And we had one response. It was from Parsons, who currently operates a mobile crisis team for us, and we've had good experiences with that service.
All right, would someone like to make a motion to approve that? Supervisor Loeb, second by Supervisor McDevitt. Now, any discussions? Supervisor Loeb.
Thanks, Madam Chair. Rob, what do you attribute the fact that you only received one response to RFP? And from Albany, anybody close to it, looking at the idea of keeping, we have money is in the community and use, it's better than money to something else.
I think Parsons was interested in it because they are a provider here, they're based in Albany, but they actually lease space out here on Quaker Road, and they have a whole team there dedicated to their mobile crisis services. And I think they felt like this program would be a good fit for that. I think the hospital looked at it too, but from decided not to respond. I'm not certain.
But no,
Go ahead, Bill.
no other hospital in Parsons that's probably the only opportunities for them to respond?
They probably were the only local entities that were probably capable of, staffing up and providing this type of service.
Thank you.
All right. Claudia?
Is this a brand new contract? Is this something,
It's a brand new contract.
brand new state money that was not available before? And why are we doing advance payments to them rather than paying them at the end of a quarter? Am I reading that right?
This is just generally how we do our contracts, is we do it on an advance basis. That's how the state provides us the funding, and it allows the agencies to provide the service without having to get payroll funds and things like that.
All right. Any other questions? Craig?
How big is this team, and is your office receiving any funds?
Our office would not receive any of this funding if it were directly to the agency. Our oversight of it is pretty minimal. I mean, they would report to us, we would monitor their utilization and that sort of thing, but we're really not involved in the administration of the program. It's all funded. Part of the question.
How many people are on this team? How robust is this program?
I believe it's in the staffing is a part of a psychiatrist for prescribing. There's a full-time social worker, full-time case manager, nurse. It would serve 48 individuals. There's 48 slots. Thank you.
Claudia?
Thank you, Chairman. Just one more. I see that the contract says, or the sheet here says the contract is to be written. Could we have that before the board meeting?
That's something I would just have to work with the county attorney's office on. So I would defer to Mary on timing of writing the contract.
I mean, we don't generally write them until after the board meeting because they're not in our time to write the contracts. But I guess if there are certain ones you want to see before, we can probably work with that.
At least to see the outline of what it is. Like he's talking about the 48 slots and...
Like a draft.
I assume, Mary, we haven't done this in the past.
Never.
I don't want to see us making things like super difficult. I mean, I just think, I take it if Mary works on the contract and she works with the department head, is it really necessary for every committee to have a copy of every contract that they're working on? Is that what's been happening in the past? Has so why now are all of a sudden are we saying we have to have a copy of every contract? I'm just questioning. Brad?
Well, maybe I can answer that.
Happy to hear that.
Because it's a new contract. I mean, it's something new. So we've never done this one in the past, right? We done this in the past?
Not this service, no.
All right, so, I mean, this being new, I could see where maybe Claudia would have a question. I just had a question, is even though it's minimal to Warren County, we're in, budget restraints, trying to collect as much money as we can. Why can't we get a certain small percentage, a minimal percentage of this money instead of going all to them to help our department oversee their department?
I just think that, that wasn't this 443,000 something, is actually includes a lot of startup funds. The model itself, the funding model, does not traditionally have that component to it, I guess, for the county.
Yeah, and I'm not trying to bust on you, but I sit in a different chair here where, I see the future coming in, and we gotta see what we can do to save money and this and that. So, it's a new program, it's starting up. You don't really know how much you're really gonna be overseeing on this, or how much time to spend, I'm just thinking if it's too late to do it now, it's a shame, but I think that, there should be some maybe set aside and reserved just in case, because that's not fair for everyone else. When your budget comes in next year and you find out, well, geez, we really should have done this, I'm a little over on my budget, and I take my hat off to all you department heads. This is, I'm only 48 days into this, 50 days, I tell you, it's mind-boggling, but I'm also got to think for the future. I'm thinking down the road on our budget and what we have to do, and I was just wondering, maybe that's something in all committees we should be discussing when these grants going, that we're not going to get a part of it, but we're overseeing it. I don't think that's fair.
The one comment I would have to that, I guess, is that we do capture federal salary sharing revenue, and that does offset expenses for our administration. So whenever we're working on this program, they have a survey that they do, they have moments that pop up in your email, and you have to respond to them. But whenever you're working on Medicaid-related activities, then you can respond positively. And based on this survey, they end up sending funding to the counties for a portion of time that you're spending on Medicaid-related administration. So this program would be an example of that, where this program bills Medicaid. This 443, as I said, that includes a lot of startup funds. So ongoing basis, like if we looked at the budget for this next year, the state aid that's coming through is a fairly low amount. Most of it is captured through their billing services. So we would capture some revenue for the time that we are working on this as it relates to any Medicaid billing program. And so what I could do is provide some sort of information for the committee as to what that revenue looks like that we can start to pull down.
But yeah, and it's just a question, I thank you, because, like you just answered the question, at least, as long as we're not doing it for free and it's pulling, like I said, and I'm not like we're here to make money, but at least cover our costs and keep ourselves budget neutral is really my goal, so thank you.
Peter?
Just a quick observation. If there's one thing that I've observed over the last couple of years is the amount of state and federal contribution when it comes to mental health, addiction, those kind of services is very significant in the state of New York. The amount of local financial participation, county participation, contributing to Rob's budget, rather small. I mean, I looked at it once and it was 1%, 2%. It was in relationship to the total amount of dollar contribution and then we look at what our county contribution is. I'm not going to say it's next to nothing, but it's very small.
Big difference?
Oh, huge difference, huge difference.
So why shouldn't we be grabbing some of this?
Maybe we should be paying more, not grabbing more, maybe paying more.
What?
With what?
With what? Pay more with what?
With I guess out of
Where's our money
out
coming
of our
from?
revenue stream and from taxpayers from the county of the state of New York.
You've seen our budget over the next 5 years.
Yeah.
I mean, I'm not arguing with you. I just, it's just...
I'm saying there are pockets in our budget where we maybe the argument could be made that we under contribute, not over contribute. And I think this is a case where we are not paying enough for the services we indeed receive.
But we're getting minimal from the state, and I'm just saying that, you know, if these grants are gonna come through and this is a new contract, why can't we figure something in? I'm
I think we're
I'm
going to
just a
have to
newbie here,
discuss
I
some
might
of
be
this
wrong.
at a later date, but I'm going to say this. I believe we have excellent department heads who work very hard to do the best job that they can, and I think we need to give them that credit. That is their job, that's what we pay them to do, so let's
I didn't
kind of
say
take
that.
the information that they have and say, hey, wait a minute, they are doing a good job. And if we have to look at giving more, then we have to wait till budget season, and then that's kind of how we're going to work at it, so, Mr. Lowe.
Just one point, what Supervisor McDevitt points out, actually ties directly into what's number 4 on our agenda.
Okay, well, we'll get to that in a minute. Rob?
I guess as I'm sitting here and we're having this conversation, I'm also wondering, you know, this is a resolution request for a new contract. I guess what I didn't think of is that I probably should be requesting to amend the budget for this amount as well. To receive the funds, right?
Yes, Kevin said yes.
So is there a way to introduce that still to today's committee meeting? Or is that-
You can introduce it, and it still goes to finance. Right?
Or we can include it right
You can
in
include it
number
in
2.
amend your request.
Okay?
And the other thing, just if I could just a minute, if there are particular things that the committee members want to see in the contract, put it in writing and give it to Rob so he can review it with the county attorney. Put your request in writing so he knows specifically what you want to see added to the contract, so there'll be no back and forth. If you can write it down, give it to Rob, and Rob can work with Mary to craft the contract, it'll be much cleaner and neater for everybody.
Supervisor McGowan?
That sounds like a great idea, Chairman, but, or,
We don't see the contract.
well, I never saw a contract. This person's coming about.
What you want, you know, if you have an idea what you'd like to see in it, mention it to Rob, work with Rob, and then he can work with Mary on getting a contract.
Well, I thought I just did that, because this is the first that's come to my conclusion. I'm just,
Oh, you're confusing me then.
sorry.
No, okay. Let's go back to Rob for a minute, please. Rob?
The other thing I could offer to share is there are program guidelines that are put out by the state relative to how the program should be set up. So I could share those with the committee. And also, you know, the RFP that we issue is out there, and it has specifications in it in terms of what we're looking for, which really is pretty much in line with the OMH program guidelines. So I can share those 2 documents with the committee.
All right.
Just quick, other quick.
All right. Go ahead,
Thanks.
Claudia, then we have...
Yeah, I think, you know, my purpose of seeing the contract ahead of time, especially because it is a brand-new contract, is to do my due diligence as a committee member. But I think it will go a long way to see the RFP. I don't remember ever seeing the RFP either, so if we see what specifications we put in the RFP, we can rightly, I hope, assume that those things will be then in the contract. Okay, thanks.
All right. Mr. Weil?
Madam Chair, my question is related to services. Seems like it's a fixed and rights contract. What happens if we get towards the end of the year and they expelled all their funds, and we still have people that need services?
The funding basically just is what it is. The agency agrees to serve up to the capacity of 48 individuals with that amount of funding simultaneously. But we have the capacity to do that, yes.
So we won't run into a situation where we might have more funds than we need to extend without using services. Thank you.
All right, any other questions? All right, well, let's, on resolution number 2, then we're going to include...
Yeah, you have a motion and a second to approve the contract by Mr. Loeb and Mr. McDevitt. Amending that motion to approve the contract and to amend the budget accordingly.
All right. Is that in agreement with both of you? Yes? All right, all those in favor?
Aye.
Opposed? Carried.
And the next request is to authorize agreements for respite services for children and youth with serious emotional disturbance on an as-needed basis for a total amount not to exceed $10,000 for 2018. You can see in item letter D there where it shows we have a line currently budgeted in the Warren County budget for $59,396. For us for the service. We would manage that again for $10,000.
All right, someone like to bring that motion to the floor. Supervisor Loeb, seconded by Supervisor Sokol. Any discussion? Supervisor Bramer?
What is the need for this outside of Northeast and Wheat House? Why do we need as needed?
You know, we thought that Northeast and Wake House would be adequate, but what has happened is that we found that with Northeast, they've had some difficulty staffing the program, and so therefore they weren't able to provide services sometimes today. And so we really want to broaden the pool of eligible providers for when the service is needed. We have someone who can call upon to provide the service.
When you say staff, are you talking about actual staff or foster parents that take the kids?
These are actual staff, yeah.
Oh, okay.
They have like an aide, or I don't want to call it an aide, I guess. I forget what they call the actual person that provides the service, but it's an individual that they hire to provide the service. Sometimes they're per diem people, and they're just not available at the time it's needed. So there's a project pool.
Who are we looking at broadening it to?
We were looking at Capital District respite. Also, Parsons does operate a community residence in Albany, Miriam House, and they have a bed that could be accessed for overnight respite. And also Vanderheiden Mall could be accessed for overnight respite.
Any other questions? Supervisor Leggett?
How many folks are being served by this? Has this been a good program for the folks?
It has been a good program. I don't have numbers with me today. Served, but again, I can provide information to you as needed, but I've been happy with the program. Again, the numbers aren't as high as we would like because sometimes the programs haven't, or at least hasn't had the capacity to serve people when they need service, so that's why we're bringing this on.
Any other questions?
I can attest to what Rob said. I'm a part-time per diem respite worker, and my hours when I got this due gig decreased from 40 hours a month to 10 hours a month. And they have quite a bit of vacancies within their Queensbury offices also. The Mark Plaza quickly.
Thank you. Any other discussion? All those in favor?
Aye.
Opposed? Carried. Number 4, Rob.
Okay, thank you. The last resolution request here is a request for a Warren County Board of Supervisor resolution to support New York State aid allocation to New York State counties to arrange for substance abuse or release transition services for individuals who are incarcerated in county jails and correctional facilities. My statewide association is the New York State Conference of Local Mental Hygiene Directors. They've been working with the New York State Sheriff's Association and NYSAC on this advocacy effort. What the request is to New York State to provide $12.8 million annually allocated for this across New York State for counties to arrange for services for individuals. What it would amount to, if successful, is an allocation of $156,000 per county for counties that are our size. Have talked to Sheriff York about this, and he did appear to be in support of it. Again, at this point, we're not at the point of actually voting to amend budgets or receive funding. So if we got to that point, we were successful with this, then I would come back to the committee with the sheriff and the plan as to how we would implement it.
So for now, we're just advocating for funding.
Right now, we're just advocating for funding.
All right, Supervisor Bramer?
Yeah, I think this is great. I think the jail is an important place to reach people. I'm in support of this. I think that's the motion.
All right. Supervisor Loeb, second to the motion. Any discussion? Supervisor Loeb?
As I said, thank you, Madam Chair. As I said earlier about Supervisor McDevitt's comments about local support reading these pages, several pages, they just heap the praise for the effectiveness of the program on the benefits to the locality. Heap the praise and the benefit of the program in Warren County, Queensbury, Glens Falls, Markham. The benefit, not for the benefit of Schenectady, Albany, Rochester, the benefit of our community. And the whole tone of the request is, and I agree, it should be done. I agree with all, I believe the data. But the tone of it is, if you don't give us the money, forget it. We really don't care about these people, even though it would benefit us immensely. So, if they don't give us the money, I think we should spend the money. Where? Where our job is leadership. Our job in this country, we're elected to represent our constituents and provide leadership. And if we see something that's going to actually benefit them, then we have to step forward and provide the leadership and spend the money locally. It'd be great to get it from the state, but I've seen it for years, the tone of, if they're not going to do it, we're not going to help ourselves. We don't want to be accused of helping ourselves. That's my soapbox.
Okay. Craig, I know your hand is up.
Right, let me remember here. Just on the radio, perhaps yesterday, driving down, listening, and there was a man that got arrested, had substance abuse problems. Before he got into the jail during that time, went through a program, kind of an interdiction, rehab and whatnot, was able to spend a reduced time in jail, came out and is a productive member of society, and he attributes a lot of it to this type of a program of where you go in to get treatment and help that's needed. So hope something like this does manifest.
Thank you, Craig. Supervisor McGowan?
Thank you, Mr. Chairman. I just want to get the record straight. I did not mean to intend that there's no money there that we throw out the program. All I'm saying is that, you know, as our budget goes down, our programs seem to be increasing. So we need to come up with solutions of being better able to help support these. And I think you mistook me as saying that I would never want to turn my back to any of our constituents in Warren County. But preparing ourselves for being able to take care of our constituents in the future without straining our budget more is what I was trying to get across. So I just want to clarify.
Point taken. We understand that. Thank you.
Well, thank you.
Okay.
Supervisor Lowe didn't make me feel that way, you know, so I just wanted to, you know,
Okay, gotcha. All right.
clear the air.
Any other discussion?
I feel very comfortable with it.
Rob?
Just a comment that in addition to the language and the, what's put forward in the resolution request itself, which does make some points about the benefits of it, I also included just a data sheet, information sheet there at the end, that provides with some benefits of the program.
No, that was good. I appreciate that. All right. If there's no more discussion, Supervisor.
Actually, thank you. On the last page, it talks about a couple of counties as examples of doing some things. I'm sorry, Albany County, Monroe, and Rikers Island. Do we do anything ourselves today? And following up on Mr. Lowe's comments,
There are not currently any substance abuse services on treatment services.
Now, do they have AA programs at the jail? They're used to.
They used to, I'm not sure if they currently do.
I think they don't. That's currently, which I find a little surprising. So I think there are people in the community that would, if they were encouraged, would come into the facility and put on this program.
Supervisor Bramer, did you have a comment before we vote on this?
I was just going to say, I don't think we have anything. When I went on the tour of the jail recently with the sheriff, there was nothing provided. I mean, they have doctors there that can help with some things, but there's no actual treatment programs. So I think that would be something that we should look into, providing these services. even if we can't get money from the state, within our budget constraints somehow.
Thank you.
I mean, we're dealing with a serious opioid crisis, and we're
I
getting ready
agree.
to sue manufacturers and do all this stuff, but maybe we can look in our own backyard and do something.
Just, if I could, as part of that, I mean, I guess some part of of looking at that is looking at the cost benefit, and around line 67 there, it shows the New York State's own analysis of the cost benefits of the jail-based treatment found that communities realize a savings of $2,846 per person served. There are 13 fewer victimizations per 100 people served. So it does benefit financially as well as, in human cost in terms of people being victimized.
All right, thank you. All right, are we ready to vote on this?
Mm-hmm.
All right, all those in favor?
Aye.
Opposed? Carried. Are we all clear on all four things that we just acted on? Because I noticed at Friday's meeting, I was a little bit bothered that things that we had acted on in the committee meeting, we were discussing again at the regular board meeting as if we hadn't acted on those. So I want to make sure that everybody that sits on my committee has a full understanding of what the requests are here, so that at the next month's board meeting, I don't hear, oh, what about such and such? So that's why we have a committee meeting, so we can kind of air these things out. So I'm assuming that we're all on board and we're all good as far as these resolutions we've acted on. Okay, Rob, thank you very much. Appreciate your time.
Thank you for all your hard work.
We just represent. Do you know how many people
What?
said,
4 items.
the state doesn't pay for this, screw it, let the agent claim it, we're not gonna do anything, we can't afford it.
Yeah, but don't look me in the eye like this.
Which eye am I supposed to look at?
Claudia.
But I mean, you see that a lot.
No,
Let's save Lake George.
Thank you.
No, what's Washington County doing? Thank you. We're not gonna do it. They were arguing
I
over
understand
it.
that. I just thought it misunderstood. That's why I said it. It's like I said, you're looking at me and that's not what I want to try to do. I just try to keep everything on the foot, because things have grown over the years. So we gotta find ways of bringing
Dee, under this, do you have the attached?
I do. I don't know if it's something that we can hand out if we have to do an executive session.
Wait till Monday when I say we need to spend $2 million on cell phone coverage in North Dakota.
I did read that.
All right, we all set? All right, Dee is ready, so we're ready.
Thank you. The first item on the agenda is permission to reduce the hours of Meal Site Cook number 9 from 30 hours to 25 hours a week. This will be a cost savings of approximately $3,470 annually. This is a position at the Countryside Adult Home for our Warrensburg meal site. It was something that the worker actually approached us about. And we did discuss it with Countryside, and we are in agreement.
So everything will go smoothly with the cut.
Yes, we've actually been kind of trying it out for the past 2 months, and they said that they should be able to get all the work done. This individual is actually very fast. She was from the jail, retired from the jail kitchen, so she's very efficient and doing a great job.
Okay, so I'll entertain a motion then to bring that to the floor. Supervisor Loeb, seconded by Supervisor Bramer. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
And the next item, I just wanted to discuss the legal assistance contract that we brought forward last month. During our annual review by NYSOFA, the New York State Office for the Aging, in October, we were asked to broaden our legal assistance services, so to entertain getting a new provider, or having 2 providers instead of just 1. So we reached out to the Legal Aid Society. They said that they would definitely be interested. They would come into the office 1 day a month, so we would have the services throughout the year. They would also provide 4 in-service type things for our seniors to attend, both in Warren and Hamilton County, and they would also provide articles for our newsletter, so we could reach our population better that way. In January, I was contacted by Mr. Clements about his contract renewal. I explained to him that we were trying to also have a contract with Legal Aid Society, so we wouldn't be able to give him all of the money, but we were going to still be contracting him. After that, he reached out to the county attorney and myself and said that there were two pressing items that needed to be addressed right away. They were cases from 2015 and 2010 that he was asking to look at again. So because of that, I felt an audit was in order, so I went back and I looked at all of our legal services for the past year, and I had some concerns about that. After consulting with the county attorney, we decided not to renew our services with Mr. Clements and to give all of the money to the Legal Aid Society. And that was the proposal that I brought forth to you last month.
And now, I know there were some supervisors, I heard the rumblings out there, so I think this is something we need to discuss. Supervisor Loeb.
Yes, thank you, Madam Chair. On the advice of the New York State Office for the Aging, it was suggested, they were, put it in writing, suggested.
They suggested, yes, there was not anything in writing.
Right, but how about, we still have to have another party. We're going from 1 to 1. We want to have 2.
But we want to make sure that we have the legal services that we can provide to our seniors for this year. So it was our thought to contract with Legal Aid Society this year, and then next year we will reach out and try to find another entity, and the New York State Office for the Aging is on board with that.
You got the floor, Bill.
I'm wondering if counseling is in order.
If what?
Counseling is in order. An audit was performed, and you had concerns about the audit. I'm just wondering if, based on the long history with the former vendor, if counseling is in order with the former vendor so that we can move on instead of setting up this confrontational.
The one thing, Bill, I would like to point out, and I know Mary will verify, it is the prerogative of the department head to pick the attorney that they wish to contract with. So it really isn't the decision of this committee to decide who she should pick to work with as an attorney.
What are we supposed to do?
Then why are we here? Why are we doing this?
Well, explain that then, but it was her prerogative, that, at least that's what I was told. She could make that choice.
Yeah,
Right.
so D brings you her decision, you either vote for it or against it, but the board cannot say to D, you need to go contract with a party. She brings you her decision, if you vote it down, she's going to go back out and try to find someone else to contract with, bring it back to you. If you vote that down, then she goes back out, she tries to find someone else to contract with. But you can't say to her, you need to go contract with your previous vendor.
Supervisor Bramer?
Thank you. Dee, I just would have liked to have this information at the last committee meeting. This is the second time where I've been taken off guard by some new information after the committee meeting. And I would like to know what was in the audit that was so disturbing that we cannot use Mr. Clements any longer.
All right,
Second
then,
that.
Claudia, at this point, I'm going to make a motion then that we go into executive session to discuss this. And we'll go on the ground that we are dealing with the employment of a particular person or corporation. So I'll make that motion so we can air this all out. Would someone like to
I'll make that
second?
motion.
Second by Supervisor Loeb. All those in favor?
Aye.
Aye. Opposed? With that, then we'll go into executive session.